Welcome back to another Score Builders question and answer video session. This video provides members of the Score Builders team with the opportunity to explore challenging multiple choice examination questions with students actively preparing for the licensing examination. My name is Scott Giles, and I will be your host for today's journey. I will read the question and provide you with an additional 60 seconds to answer the question. Ready? Let's go. A physical therapist evaluates a patient who sustained an ankle injury during a recreational soccer game. To determine whether imaging is necessary, the therapist applies the Ottawa foot and ankle rules. According to the screening tool, which of the following factors would meet the criteria to refer the patient for an X-ray? Option 1, pain near the medial malleolus and an inability to bear weight. Option 2, pain near the lateral malleolus and passive dorsiflexion limited to 5 degrees. Option 3, pain near the posterior calcaneus and a positive talar tilt test. Option 4, pain near the cuboid and swelling of the ankle joint. Ottawa foot and ankle rules. The Ottawa foot and ankle rules is an instrument used for patients with an acute traumatic injury to the foot or ankle. For example, twisting injury, direct blow, in which a fracture may be suspected. If the patient meets the criteria within the instrument, then they should be referred for radiographs to rule out a fracture. Let's explore each of the options. Option 1, pain near the medial malleolus and an inability to bear weight. To determine if the patient should be referred for radiographs, the patient must have pain near the malleolus, that is to say either medial or lateral, and meet one of the following 2 criteria: an inability to bear weight for 4 steps, or tenderness at the tip or posterior edge of the distal 6 centimeters of the malleolus. Option 2, pain near the lateral malleolus and passive dorsiflexion limited to 5 degrees. Pain near the lateral malleolus is one of the criteria that must be met to refer a patient for radiographs. While a limitation in ankle range of motion may be associated with an ankle injury, it's not a factor that is considered as part of the Ottawa foot and ankle rules. Option 3, pain near the posterior calcaneus and a positive talar tilt test. Pain near the posterior calcaneus is not a factor that is considered with the Ottawa foot and ankle rules. Rather, the patient would need to report pain near either malleolus or in the midfoot. Additionally, a positive talar tilt test would be associated with a ligament injury, not a fracture. Option 4, pain near the cuboid and swelling of the ankle joint. Pain near the cuboid, that is to say midfoot, is one of the criteria that must be met to refer a patient for radiographs. However, swelling of the ankle joint, while possibly associated with an ankle injury, is not a factor that is considered as part of the Ottawa foot and ankle rules. The correct answer is option 1. Let's explore the all-student data. 70% of students selected option 1, pain near the medial malleolus and an inability to bear weight, the correct response. 15% of students selected option 2, pain near the lateral malleolus and passive dorsiflexion limited to 5 degrees. 5% of students selected option 3, pain near the posterior calcaneus and a positive talar tilt test. 10% of students selected option 4, pain near the cuboid and swelling of the ankle joint. System classification. This question is a musculoskeletal systems question which represents approximately 27% of all exam items. Content outline classification. This question is a physical therapy examination question, which represents approximately 24% of all exam items. Level classification. This question is a level 2 question since the question requires students to integrate numerous pieces of information or to apply knowledge in a given clinical scenario. Remediation of level 2 questions occurs by increasing flexibility with academic content and by carefully analyzing decision-making processes when answering applied examination questions. Academic focus area. Looking to review related academic content? Check out page 114 in PT Exam the Complete Study Guide. Thanks for joining us on the Score Builder's question and answer video session. See you next week.